I call this Tuesday, July 28th, 2026 City Commission meeting to order. Will you join me in a flag salute?
Of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
DJ, would you lead us in a prayer tonight?
Please bow your heads. Loving God, we pray today as you send your Holy Spirit through us in our decision-making and our convenience to work together for the better good, in your grace, with your will, and with a desire to make the world and our community a better place. We pray that you guide us through our steps, our decisions, and our communication throughout everything that we do as it comes before us. In your name, we pray.
Amen. Amen. Thank you. All right. Open the meeting to public input. Is anyone out there who would like to come up and speak in public input? State your name and address.
Hi, Roger Lomchek, 1147 South 220th Street. I guess we're kind of doing this out of order if the budget's going to be presented this evening, but obviously property tax is an issue that's near and dear to everyone's heart. And I guess I just wanted to ask the question in advance, are we going to see an actual reduction in the dollar amount of taxes people are paying?
Could you say that again, Roger? What are you asking for?
Is the amount that people are going to pay in property taxes for the city share going to be reduced?
So the intent of the commission, I think we've all spoken throughout the last several months for our budget hearings, is to reduce spending and to reduce the mill levy. And that is the intent. I haven't seen the budget fully yet. I know that's what we've been working towards.
On something you may be aware of this, simply reducing mill levy does not mean people will pay less in taxes because of the inflationary situation with values continuing to climb. It's real easy for a reduction in mill levy to still result in higher taxes being paid. And I guess that was part of my point a year ago when I came to you. And
but Roger, realize we don't control the appraised value of things, right?
I understand, but what every elected body does control is the budget that they choose to set and submit to the county clerk for the clerk to take what money's needed to meet that budget. That was the issue last year when a budget was set based on incorrect valuation numbers or incorrect assessed valuations, and then ended up having to raise the mill levy to make up for that. Something that all of the elected bodies absolutely have final say on is how much you're going to spend, and that determines how much money is going to be taken in property taxes each year. I guess that's my question, whether if the mill levy is simply reduced back a little bit from where it was last year, even if it's back to where it was last year, that's still going to result in a net increase in taxes paid compared to a year ago.
Well, like DJ said, that's certainly, I'm not going to speak for my fellow commissioners, but I think after the last several months, I think it's clear that's our intent. And I think the city manager and staff know that as well. So without stealing their thunder, without even submitting the budget officially yet, sure, until later on in the agenda, I mean, that's the only answer I can have for you right now is that's, like DJ said, it's certainly our intent.
Okay, I guess we'll see what the numbers are. Okay, thank you very much.
Thanks, Roger. Is anyone else like to come forward in public input? Seeing none, I close the public input portion of the meeting and move on to consent agenda. Or are there any items to be removed from the consent agenda?
I have a question about item D.
D? Yeah. All right. Excluding item D, is there a motion to approve item A, B, C, and E, and F?
Go ahead.
You can
Move to approve.
second.
It's been moved and second. Roll call vote.
Brooks.
Yes.
Height.
Yes.
Mansell.
Yes.
Perry.
Yes.
Sigley.
Yes.
All right, item D, approval of staff recommendation to accept an emergency solution grant from Kansas Housing Resource Corporation in the amount of $106,525 to support homeless services within our community for the grant period of July 1st, 2026 through September 30th, 2027, and authorize the mayor to sign the necessary documents on behalf of the city.
Hi, good evening. Happy to answer any questions.
Perfect. So just a couple of things. I know I asked you before about this grant and the process of it. Is there a point where we can get a back brief on the exact amount? I know we can't give us all the information on who it's being used for and how, but can we get some type of a back brief on?
The spreadsheet that I gave you guys the last time?
Similar to that, that's a lot of good
Okay.
information, but just I guess it's not so much, I don't want to use the frame, exactly where it's going.
Okay.
But just more information on how it's being funded or how it's being disseminated throughout each quarter. No, I need to sit down with you though and look at maybe some options. I know I gave some examples last time, but I haven't seen any additional information provided. So it's just for the commission to have a better idea of how the money is being distributed, not just solely off how many families it's affecting, but regional, part of the city, I guess the beans and bullets of it. So
Okay.
And I'm not sure how much you can release, but I know it's,
Okay, so these are HUD-funded money that is came through the state Kansas Housing Resource Corporation, and then we apply for them, and then we are granted that money. And then how those funds are used is rapid rehousing, which is helping those that are literally homeless. So how those individuals are chosen is they do a homeless certification, and then they do an assessment. And so that assessment determines how likely they're going to die if they're still on the streets.
the urgency.
Yes. And then when we do case conferencing every Tuesday, and then if we have funding, the top individuals, because they're scored, so those top individuals get referred to programs that are open. So like in my case, they would be referred to the city, and then we would contact them and help them get housed. Is that kind of what you're
That's part of it.
looking for?
Yeah.
Okay.
Part of
And
it,
then as far as the homeless prevention side, that is helping individuals that are about to become homeless. Like they're, like a single parent and a child, they're about to be evicted. They can come to our office, provide the required documents, and then we can help pay their back rent and then rent moving forward to keep them housed so they don't become homeless.
Okay. And that was a big chunk of how you briefed it last time too. The question I'm looking at, I guess to narrow it down, is the actual information, if there's reoccurring need for the same individuals, or is the grant pushed off of and requested off of the need by a roster that when people apply for this, or is it off of, what numbers are you using to?
It's off the assessment that they're getting.
So the sole information is off them coming in and requesting it, and
Yes.
then, okay.
Yes.
And then as far as the reoccurring use, that information would be helpful too.
Reoccurring use, our goal is to keep them housed. But I believe Cheryl asked this question in the past. If they continue to use it and abuse it, we won't assist them any longer, whether they need it or not. The goal is to keep them housed. There's a point where if they're abusing the assistance and not doing what they need to do, we can't continue to use money on them and use that for somebody that will do what they need to do. Does that help out a little bit too?
It does.
Okay.
And then the last part is I guess the window. If you're on this list, you come and they do an application, how much time it takes for them to qualify and get on this for use? Is that still over a year?
No, the year is our Section 8 waiting list. That's where the year comes from. This, if they make their or they do the homeless certification and get on the list, it just kind of depends on who has money available. Typically, I run out of money quite quickly because it's not a lot. This year we did receive more because of the great the great job that our office has done in the past couple of years. So we did receive more, but it just kind of depends on how active the individuals are to find the housing, because we can't find it for them. We can assist them in providing landlord lists and things like that, but it's depending on how active they are on doing the work and then keeping in touch with our office.
Okay.
And that's through different, service providers. You'll hear from a group today that really helps also. So just different providers trying to, we all work together to get these individuals housed.
Try to get it figured out. Okay. And
So,
that's-
so it's not a year by
so
any
it's
means.
Less than a year, the
Yeah.
application they run through.
Yeah, I mean, like some of them, they come if I have funding and they kind of already have a place kind of lined out. It can just, take maybe a couple of weeks to get them through our process of the inspection and landlords correcting and going
Is
that
that
way.
your total funding, 106,000?
That is the total ESG grant period, yes. Yes,
Do you have
so
other funding?
that's just the ESG grant, yes.
Yeah, but I'm saying, do you have other funding other than the ESU grant?
We have our TBRA that we're gonna apply for, and then we have our Section 8,
Okay.
yeah,
Do you have a list going into right now with this approval?
yes.
And
A list
then-
of individuals that are needing assistance, yes.
What's the cap per person or family?
So our assistance, how many months we help them, or how many times we help
Dollar-wise.
them?
Well, 106 is gonna go fast.
106 is going to go fast.
So that's why I'm saying, is there a cap?
So
on how much-
typically, in the past year, I've helped at least between 9 to 10 to 12 people, so I try to keep it within,
9 to 10 to 12 for 106, so the
well, that
needs-
was less. That's what I used
oh,
last
yeah,
year.
But the needs of the many are gonna outweigh the needs
Yes.
of the few as far as the dollars here.
Yes. Yeah, so I do what I can to screen what I can. We take the highest risks as much as we can, for the rapid rehousing. So I do my best to do what I can.
That's why I wondered if there was a cap.
I
That way you
can't-
could spread it out a little more.
I don't so we do short term, so that's where the cap kind of comes up. So there's short term and medium term. Short term is 3 months of rental assistance. So then that way we can basically help them in,
A lot
get
of
them
times that's a lot of
established.
money it ends up being quite a bit of money.
Yeah, but that's why we have the security deposit program too. So that kind of helps alleviate some of that money being spent in ESG is to help with the security deposit. And then the ESG funding is just helping with the rental part of it. Does that make
Yeah,
sense?
yeah.
So that's kind of where the cap is. We do short term
And this is by the year,
by a 15-month period, yes.
15 months, wow.
Yes.
You guys are doing a good job of,
Yeah.
obviously have been good stewards with that money. And like Cheryl said, a lot of need, but
Yes.
not a lot of money there, not a lot of dollars. So
Yeah.
we're thankful that, for you guys, taking that serious and being, like I said, good stewards of it. Clearly, they wouldn't increase our money if they thought we were doing a poor job of it. So
Right.
appreciate your work.
Thank you. I appreciate
Thanks,
it.
Megan.
Thank
The
you.
only other question I have, looking at the match certificate form, and the third block down under the match category for staff salaries. So the amount requested is 40,611, but the amount of match is 73,930. I didn't have.
So that is basically a little bit of a portion of everybody that touches ESG. We can use a percentage of their salary to match towards the grant.
Okay,
Does that make sense? So like my office, if anybody in my office touches ESG finance, they do the payments. So we can take a portion of their, like a small percentage of their salary, IT, because they help us with if we have any computer issues.
it's all categorized.
So it's all
together.
categorized into that. So that's where it may look higher, but that's how I do my matches. It doesn't have to necessarily match the amount requested, it just has to match the total amount awarded.
Awarded in
Yes.
Okay, yeah, I saw the
Yeah,
30,000 difference in there, and I didn't
It
understand
does
why,
look a little
so-
bit weird, but as long as we have the total amount match requested or awarded, then we're fine.
So this 106,000, do you apply for more money in this grant, and that's what they decide they're gonna give you?
Yeah, so I actually applied for 196,000
Right,
and
that's
we
what I
were
said.
awarded 106, so, yeah.
And because you're doing such a good job, it goes up a little bit.
Yes. So the last few years, it's been pretty much the same. And we were told, because I asked why we got a decrease a few years ago, and more agencies have been applying. But now the last year and this year, they're making it more competitive. They're looking at the outcomes, and we do have great outcomes, so that's why we were awarded additional funding this year.
Good, good.
This isn't the only entity in this area that has money.
That is
You have
correct.
Catholic Charities and all these other people.
Safe House receives Yes.
Yes.
Yes, I have a list of all the different agencies within the 12 counties around us that have this funding as well.
Well, we definitely appreciate all the hard work you do. I know there's a lot of
Thank you.
juggling, and I didn't mean to put you on the spot
No,
tonight.
you're
I
good.
just,
No,
identified
no,
these
I love
this
it.
morning,
This
so-
is
She
what I
knows
do
her
every day.
stuff, for
Yeah.
sure.
I do.
I'm glad you had
We
the
appreciate
answer
you.
for it.
Yes,
And your staff, tell everybody
Yes.
thank you.
I will. Thank you.
Motion to approve.
Been
Second.
Moved and seconded. All in favor say aye to approve
Aye.
item D.
Aye.
Aye. All opposed, same sign. Motion carries. Thank you. Special presentation. IMA representatives from IMA will present information regarding the city's health insurance program.
Mayor, Commissioners, so we have Christy Powell and Nick Johnston, and everybody knows Kim. And we are self-funded, so we have IMA. We don't have a Department of Benefits. We do have a division in HR that helps with our benefits, but we really rely on IMA and have for a long time to help us determine what's the best level of health care that we can give for to maximize our dollars. So they manage it every year. They meet with us every year. They usually present every year, and this year they are here to present again. So Kim, I didn't want to jump you, but I didn't see you standing there.
No, I was going to do a quick introduction, but Darren just did it for me. So I'm going to go ahead and let Christy and Nick take it away, and I will stay up here for any questions.
Thanks, Kim. Thanks, Darren.
Yeah.
Well, I'm Christy Powell. Thanks for having us. As Darren and Kim said, we're going to do some quick updates for you guys. Where you're at historically from a plan performance perspective, looking forward on where we're at from a budget perspective, and some, obviously some requests and some tweaks that we're going to be asking for the coming years. So this is really the Nick show, so we'll let Nick take it away, but I'll be here for questions as well. But Nick is your client executive. He's very much in the weeds on all of the financial details. So Nick, this is Nick's masterpiece, so we'll let him run with it here.
Yeah, thank you, Christy. Starting off, wanting to really look at where the health plan has been. And so you'll see on this chart, we're looking at dating back to 2012 up to 2025. That was the last full plain year that we had data on. And so you'll see two lines on this chart. That dark blue line is looking at where costs have actually been. So this is what the health plan has actually experienced. And you'll see in that 2012 to 2023, 2022 timeframe, health plan costs have stayed right around that $2 million mark, which is really pretty incredible with what we have typically seen in the health plan market. There has been a rise in 23, 24, and 25, which we'll get into here in a little bit. But when I look at this, you'll see that dotted blue line just above that. And that's looking at healthcare trend in that same time frame. And so this is really comparing, had the city of Pittsburgh health plan ran at trend, like what we're typically seeing, this is what health plan costs we would expect. And so you look at 2025, that number's up to 4.5 million compared to actual costs that were at about 3.1. And so really the main bullet point or highlight I have on here is looking at from 2012 to 2025, that's about $12.7 million in savings versus trend when we look at what actual costs have been. And so that's something that compounds every year, right? And so that's about $905,000 annually better than trend in this time frame. On the next page, we really wanted to kind of focus in on, okay, so 23, 24, and 25, we are seeing an increase in costs. So where is that coming from? You will see a bar chart which breaks out all the different health plan costs that make up your plan. And so you have certain administration costs, you have certain stop loss premiums, so that stop loss insurance is a way that protects the city from really catastrophic claims. And then you have the claims themselves that the city is paying. And so when you look at this chart, really all of the bottom line items, so your medical admin, dental claims, stop loss premiums, those have all stayed relatively the same. There have been increases, but moderately. Where you'll see the biggest jump is that top bar chart, which is medical claims. So in 2023, for example, that was at $984,000. That did jump up in 24 to about 1.8 million. And then in 2025, 1.5 million. And so when we look at where is this increase coming from, it's mostly on the medical side. There was also a jump in pharmacy claims in 24 versus 25. You'll see that went from about 600,000 to 812,000 in that 1 year. We have some additional data on that on the next slide. And so since we kind of targeted that it's claims that are causing the increase to the health plan, really wanted to dive into those claims itself. And so when we look at a health plan, there's really four main buckets. You have your inpatient claims, your outpatient claims, your office visits, and then pharmacy claims. And so we really broke that out in each year in 23, 24, and 25 to show you what claims were falling into those buckets, as well as showing you what our commercial benchmark data is there as well. So you can see what for a group your size, what we would typically see in claims utilization. So in 2023, for example, there was 362,000 in inpatient claims. For a group your size, we'd anticipate that number to be closer to about 532 in that respective year. So the health plan, despite some of the recent increases, is still well outperforming what we typically see for a group your size. There have been some kind of one-off situations. In particular, in 2024, you'll see a very large increase in inpatient claims. This was a pretty rare situation, and really due to HIPAA purposes, I don't want to get into the nitty-gritty of kind of what went on, but there was a high-cost member on the plan with a pretty catastrophic claim that really caused that to jump in that 1 year. You'll see in 2025, inpatient claims are back down to about 350,000. So really where 2023 levels were. One other piece I did want to call attention to was pharmacy. I touched on that briefly. In 24, you'll see that was at about 600,000, which jumped up to 813,000 in 25. That is really being driven by GLP-1s. And so I'm sure you all are aware of GLP-1s. You'll see stuff on commercials and celebrities talking about it, but those are your Ozempics and Wegovys and those weight loss drugs. And so the health plan was actually covering those for weight loss medication. That jump alone was really driven by that one piece alone. And so moving forward, in 2026 and beyond, members can only fill those GLP-1s for diabetes use only. They're not allowed to fill those for weight loss management.
That's what I was gonna ask you. Those medication, yeah, that's for diabetes, and that's doctor prescribed, but are they going to the doctor and doctors giving them medication for weight loss?
That's a great question, and so there are guardrails put in place to where you have to get a prior authorization from your doctor that says this is for diabetes use only. They can't fill it for any other reason, so they have to get a doctor's note in order for the health plan to fill that for diabetes use.
But it sounds like that's what happening, wasn't it?
In 2025, it was really open for weight loss.
Yes.
And so per the FDA, I think it's if you had a BMI over like 30, you're eligible to get it for weight loss. And so members were able to do that in 2025. In 2026, so now and beyond, it's only approved for diabetes use.
Well, I'm not a doctor, maybe Dr. Siegley can answer that. So if you're taking a medication for diabetes and you're using it for weight loss, is there any long-term effect because you're using it for something else?
If you're taking it for diabetes, it's for diabetes.
Right.
And if you're heavy and you're diabetic and you're taking it, then you might lose weight. But most of these GLP-1s and 2s are for diabetes itself.
Right.
So if you've got an obese person who's a diabetic, and a lot of obese people are diabetic, you get the benefit from the drug if you get it prescribed. You get double benefit from it.
Yeah.
But so what you're saying is it can be used for diabetes, but not for weight loss. It can be, right?
Right, they have to have a diabetes diagnosis from a
Right.
doctor
Okay.
itself
Right.
So-
in order to fill that medication.
It's been recategorized as cosmetic
And
at this point.
that's a level 1 diabetic too, an insulin-dependent diabetic.
Yes.
So, yeah, there's not that, there aren't hundreds and hundreds of thousands of people on insulin.
Yes.
In this country.
Right. And so when I looked at the health plan data, there's really, so so your Ozempic is still only used for diabetes use, but what's FDA approved on the Ozempic side would be the Wegovy. So that same active ingredient in that drug. And so when we looked at the number of claims that were filled for Wegovy, which is purely for weight loss, not the diabetes portion, that was $284,000. So when we look at what the healthcare was spending on those, filling it just for weight loss, not for diabetes, it was at $284,000, which almost explains to a T why pharmacy claims went up from 600,000 to 813.
Kim, didn't you used to have a program for healthy employees what was the name of that program?
So we do have a wellness, is this on?
Yes, wellness program?
Yeah, we do have a wellness program. We do different, well, obviously that's part of our golf program. We've got walking programs that we do throughout the year. So we do have different wellness options.
Do the employees have to sign up for that, or do you just offer it and you ask them to come? It's not mandatory, right?
It is not mandatory, no.
So if they're losing weight from these drugs, wouldn't that make them healthier in the long run? Maybe they lose the weight and then they feel better and maybe they're on the right path. Maybe it would offset
some of it,
later.
but not, yeah, right. And there's definitely validity to that. And there's a lot of studies that have come out. When you look at the upfront costs of these prescription drugs when they run through insurance, it's about $1,000 to $1,300 a month per fill. Mm-hmm. So the question is, will medical costs for that member go down by that same amount? And we just haven't seen that from an ROI perspective.
And are you negotiating the price of the drugs? Are you able to do that?
So yeah, we actually, one of the things that we did do is go out to bid this year with your prescription drug manager. So that's their responsibility as the PBM. You guys are on a 100% pass-through contract, and so what that means is exactly what those PBMs are getting for those drugs, they're charging the health plan exactly that. So they're not doing any spread pricing. They're passing along 100% of the rebates back to the health plan. And so that's one of the things that we wanted to make sure you were with a 100% transparent PBM.
A lot of times, you can get RX.
Yeah, and then that's another component.
Or there's coupons online that you sign up for a program. And so that's why I was asking. And I know that program she was talking about was.
Yeah.
This number covers employees as well as their families that are covered under the program, correct? So
that's correct. So we're looking at employees, spouses, it could be children that are on the health plan. Yeah, total members. Yep. So one thing I did want to touch on briefly is just from a benchmarking perspective, both from a plan design and contribution standpoint, how City of Pittsburgh stacks up. And so we really have two different benchmarks here. You'll see on the left-hand side, that's our Kansas benchmark. So that's really just the Kansas commercial benchmark. It includes private, public sector, any size group. And you can see, just for an example, individual deductible is $1,500. The city plan is $500. So anything in green indicates that it's better than benchmark. Anything in that reddish shade means that you're above or maybe slightly worse than benchmark. And so I won't go line by line here, but you can see a lot of green on this slide. So it's a very competitive, rich health plan, both when we look at the commercial benchmark and the Kansas public sector specifically. Very rich there as well.
Kim, how often do we brief this to the employees and their families? How often do they see this information and know? Is it just when they come in, or is there?
So we talk to a lot of the employees one-on-one when they come in about things. We, at open enrollment in October, go through all the plan design, which we're going to do again this year with IMA because we've got some changes that you'll see here coming up. So IMA, we've asked them to come in and help us go through that with the employees. But anytime there is a change, which we only make the changes before open enrollment, so at this time of the year. So we brief them then, and then when we get new hires in, brief them on the plan. Since we are self-insured, it's important that employees understand the plan.
It's a lot of information to take in, and especially if they don't need it for a long period of time, and then all of a sudden do, they need to know how it works and what's going on. Okay.
Is the money taken out prior to the pay, or is it taxable, or do you have it as a line item on their check? Or how does that
For
work?
their insurance, yes, it's taken out, each pay period,
On their gross?
pre-tax, yeah.
Pre-tax.
Okay.
So Kim alluded to this earlier, but the city is a self-funded health plan, right? And so what we wanted to show was in 2023 through 2026 year to date, how the budget has compared to actual costs that have incurred. So you'll see, you know, on that first slide from 2012 up until this point, really costs have stayed at that $2 million mark. But unfortunately, with the rise in healthcare expenses, we have seen a decrease to the overall health reserve. Because of that, you'll see in 23 about a $2 million surplus in that reserve, which dropped to about $1 million in 24, 25, right around $100,000, and then we are showing the 2026 period running at a deficit of about about $600,000 in the 2026 period alone. So one thing we wanted to project forward is looking at how the health plan could potentially finish and give you a projection on that year-end results. And so we have all the different cost components of the health plan broken out here. You'll see what's highlighted in that top portion is actual costs that we have seen up to date through May. From June through December, there are some illustrative costs shown there. So we have your fixed costs, which we know, pretty certain what those are going to be on a monthly basis because those are a fixed cost. They just change a little bit as enrollment goes up or down. But really, it's going to be around that $62,000 mark a month. The medical claims, based on what we've seen historically on a monthly basis, there's going to be some months where it's higher than this and some months it's lower, but just for illustrative purposes, we've kind of set it at an average. And so combining all this together, we would estimate the year end to finish at about an $800,000 deficit. Unfortunately, based on how some of the claims have been running, in particular the last year or two.
Were you able to see that the deficit was going down over the last couple of years? What?
Oh, yeah.
Why, okay, but why were we not talking about it then? The deficit coming in there. Where would that money come from? Like back in 25, if you were getting close to being depleted, wouldn't it have been a dire need at that time? Because now you're just like down under the line, so, and you're talking over $750,000, huh?
We are totally at the mercy of our claims. When I got here, there was less than 100,000 in this fund. We built it up to 2 million over like 9 or 10 years. But one of the claims, if you look at the bar chart a few slides ago, one claim took $800,000 of savings. So that in of itself, we know about it and we look at it and we think about it, but we still have reserves. But when the next year's claims, you have 6 or 7 claims that all hit at 90,000.
Right.
So, I mean, it's just.
But does that reserve money that we have other than this ever flow into this?
Well, that's what this next chart's about. That's
Right,
why we're bringing it up
so-
to you today. I mean, it's, and remember, it's a projection, it's July, so they've gone ahead and projected out the rest of the year, but it's just, I mean.
It's like anything, you
we
go
don't know when
along
the
and you
claims-
can
I
be
mean,
fine for a long
I
time.
mean,
and then-
somebody may have a heart attack today, God bless them, and we're dealing with it, and it's we've watched the total, we've watched it go up, we watched it go down, and we're telling you today that it's not only down. The big question, I think, today, for the takeaway is, what's the trend? Is this 2 bad years, or is this just the new medical costs that we're gonna need to cover? And that's really what we're gonna bring your attention today.
So is there an additional, like a catastrophic additional plan that we could look at that would assist with these higher claims when they come in like this? Or is there something else we can do other than
We have
just
that.
react?
Yeah, so that is in place today. That's that stop loss insurance I was referring to earlier.
That's the only thing that's out there right now?
Yeah, so it protects the city for up to $100,000 per member. And so that's kind of that deductible, that anything over that, then the stop loss carrier picks up any of the claims. There was the one instance with the one individual that unfortunately, It was a drawn out process to where it happened over multiple years, actually from when it incurred, and it fell outside of that stop loss period to where they'd cover that. There was negotiations going on with the provider, and it was just a very rare one-off situation to where that really hurt. But on a normal basis, any member, once they exceed $100,000 in claims, the city's done paying for that member.
What is the percentage, if it goes into the catastrophic category, what's the percentage that they pay?
So anything, once it hits $100,000, they pay 100%.
After that?
Yeah.
So if, a $600,000 claim, so it only costs us $100,000.
And that's what I was alluding to where this was that one-off scenario to where it actually fell outside of what they'd consider the stop loss period to where they'd cover those.
So that's where I'm circling back to now, is there something available out there that would protect the city after, in these cases where the stop loss doesn't apply because of the.
So does it protect the
timeframe?
city or the employee?
It's the city, and
But
there
it
is
doesn't.
another stop loss contract that's a little bit richer that we could buy. We've increased your coverage over the years to be more what we would call mature. But it comes with a cost, and so we've always been trying to balance fixed costs with the exposure. This one particular claim came in when the No Surprises Act became into effect, and that's probably too much in the weeds for you guys, but it was new legislation that came into effect that allowed the provider to negotiate 24 months out past the time that the claim was incurred. So it was really a perfect storm. We didn't really have any way of knowing that was going to happen, and the city was well aware that there is stronger stop loss contracts, but we just didn't need them at the time. But now with this new legislation, we're looking at a stronger stop loss contract for this upcoming renewal, just so there's no surprises. But your team is looking at claims on a monthly basis. It's not we weren't watching this, we knew it was happening. It was just truly a perfect storm with the legislation that came out in that year.
So if the stop loss is 100,000, maybe it's too soon to ask, but what would you recommend that go up to?
The stop loss limit at 100,000 is the right amount. It's the coverage type that was just alluding to. So looking at basically kind of having a gapless stop loss contract to where there's not a tail that runs out on incurred and paid.
So you said something that's happened over multiple years, is that
It
correct?
was one claimant over multiple years of
One claim,
negotiating.
so it's $100,000 per year during that multiple claim,
It was a $600,000 claim
per claim.
that was incurred and paid out past the stop loss contract.
The thing you're missing, and this is confusing. So the stop loss doesn't really come in hundreds, 200s, 300s. It comes in months. So the 100,000 is the cap because most of our claims are well under that. But you can have a 12-12, which means anything in that 12 months is going to be covered. We moved to a 12-18, I believe, years ago, which
When we
means.
took you over, you were 12-15, which means you had 3 months of run-out coverage, basically. We moved you to a 12-18, gave you 8 months of run-out coverage, which was more than you ever needed. You never had claims that went past that. Then this claim obviously went well past the 18 because it was the No Surprises Act. The provider was negotiating on the bill because it fell into an emergency category where it allowed them to do so. And it, again, a very, very unique claim that we can't really talk about because of the nature of privacy.
The Traveler's Choice Kids Line.
But it's, that's the nature of being self-insured is we're paying the bills.
But you're never leaving the employee.
Oh, no, no,
The
no.
employee
an island,
didn't have,
but, you
the
know,
employee wasn't, this was all employer related
Yeah.
on the claim liability, absolutely. The employee got the coverage they needed, that all was taken care of.
And I didn't mean that we were depleted. I mean, I know it was depleted, but I meant a lot of times you have money setting to the side and it funnels in whenever it gets to a certain point and then it'll take a while to build it back up to where the 2 million was before. But that's in a perfect world when nobody gets sick, so, and that doesn't happen
And
anymore.
we always are balancing how much to have in that reserve account too, right? We're not trying to overfund
Right.
this, we're trying to keep it in a healthy balance so you guys can use that money for other initiatives, right? We're trying to make everything that we do in our business is very much a balancing act of, we don't want too much cash in there, we need enough cash.
But
this was really a perfect
Shouldn't there
storm.
be
It's about
like a
2.5
million would be the,
2.5, 3 months of claims is ideal.
is ideal? 2.5, 3 months, okay.
And where we're at right now is This next slide is gonna show you that the program month to month right now is not in balance. It was a couple of years ago. And so part of the imbalance, a lot of the imbalance, are adjustments to the plan that we've already talked about, RX and things like that. But the other part is, are we gonna have huge claims? And if the claims go back to how they've trended for 10 years, we don't wanna overcharge the employees and put more taxpayer money into the plan and build up another huge balance that we can use to do other services. So the whole thing just chases. We've been very lucky for 8 or 10 years. I wouldn't say unlucky, because we're taking care of our employees. And if
Sure,
somebody has a
sure.
$1 million claim and they work for the city of Pittsburgh, we're gonna take care of it. But we need to make sure the plan is in balance every month. So we can build a small deficit and over the time, hopefully build a bigger one.
So next section is gonna be like, what are we doing about it? How can we kind of get back to balance, right? So that's the next, as we wrap up here, what we're gonna share with you guys on some of the work that we've already been doing, with the team here.
Yeah, so this slide looks in particular at the medical network. What we did is we went out to bid, today that is through Providers Care. And so one of the things we wanted to do is go out to bid, make sure you all were getting the best discounts possible with the best access for your employees and members that are on the health plan. And so PHCS is what the best network solution that we found was. They were projecting, so what they do is what we call a claims reprice. So they looked at the last 12 months of claims. Had the city have been with PHCS during this time, what would have costs been? And so they looked at about $370,000 in network savings just by deeper and more competitive discounts through their network than your existing Providers Care network. And so there is that savings piece of it, which is pretty significant. And then the other piece is whenever you change networks, there is going to be a little bit of disruption with some of the providers that you can see. And so they did do a full disruption analysis, and we have that highlighted on the bottom right-hand section. Really, there's two that jumped out to me in the Sound Physicians Emergency Med and then the Crawford County Mental Health Center. But every other, if you don't see a provider or a facility on here, that means that it would still be covered. So those two are the two that jumped out to me, with about 16 members that have utilized the mental health center, and then 31 in the Sound Physicians Emergency Med. And one thing that we can do kind of proactively, which we've already actually done, just in case that the city would like to move forward with this option, is let's try to just get them in network. That way that, 1/1/2027, these providers would accept that PHCS network solution.
Is that Sound Physicians Emergency Med, the emergency room, is that right? Visits to the emergency room?
They're the outsourced ER.
Here?
docs.
Doctors, yes.
So they've already, the important thing
They've
is.
already reached out,
They've already
yeah.
reached out to both of those double-digit members and said, can you be part of this network? So we're pretty confident that if we made that change, not only would we save the 371, but we'd also be down to under 10 individuals that didn't use a provider that would have been in that network. And that doesn't mean they don't have other options. It just means we didn't want to, it's just not all about the money. We've got a lot of employees. We're at a 4 states corner. We've got people that go to doctors here and there. We want to make sure people can keep their doctor if they want to, but it's just very hard to do when you change plans. But for that amount of money, we probably need to change plans because we're obviously out of balance.
So the oversight network, if it's not on this list, will still be normal for all the employees and their families?
Yeah, so 94% of the claims they reviewed, they said, yes, that would still be in network with us today. So a large majority would still be in network. And really the majority of that, 5 or 6% is coming from those 2 providers that we talked about, that if we could get them in network, it would be great.
What do the negotiations look like for that?
We're working through the vendor themselves. They have their own network team that's their job. Every day they reach out to these providers and facilities to try to get them to join the existing network. So,
In a hospital setting on an ER, you never know sometimes if somebody is in the network or not.
Right.
And they may have treated your city employee, but they're not in the network, so what happens then?
So that's actually the good thing about the No Surprises Act that Christy was alluding to earlier, that unfortunately we had that situation with the large claimant. But one of the things that bill did is if it's an emergency claim, whether they're in network or out of network, they have to charge the health plan that in network rate.
Really?
Yeah, so that was actually, yeah.
It normalizes.
Wish that was that way for everyone.
Emergency care.
That's something.
It's only for emergency care, but yeah, so that's, yeah.
Yeah, and the hospital itself, as you know, is in network. It's just this contracting group, this Sound Physicians is contracting the ER docs locally, and that's why it's falling.
But
that's why it's
sometimes
hitting
the
this list.
information that the hospital has on their computers is not transferred over to Sound Physicians, because we recently had a problem with that, and they had as a self-pay, and when the person had insurance, so that's why I asked that question.
Yeah.
It's a
But
very convoluted industry that we work in.
I was gonna say, one person in her office would be mind blown doing that every single day.
We do.
Trying to keep track of
That's
every
what they
single
do,
claim.
Full time.
Yes, so, yeah, thank you. We do that every day with
Oh, yeah.
employees, and they have an amazing team that we can send those bills to, and they help resolve them quickly. So, another great service provided by them.
You can never assume.
That's right, yeah. One other piece that we did want to look at was the plan design. So as you all saw on that benchmarking slide, the city's plan is what we'd consider, a very, very rich health plan. Unfortunately, with just the increase in claims cost, one of the things we wanted to look at was maybe tweaking that plan design to a little bit closer or at par with that benchmark. And so still a very competitive plan design. I mean, a $1,500 deductible is really standard in what we kind of see in the market. Bumping up that out-of-pocket a little bit, some of the co-pays you'll see in that bold and blue, but making these plan design changes, what we'd estimate is about $210,000 in annual savings by making these recommendations on the plan design.
So you're bumping the deductible and the out-of-pocket up or higher? Is that what?
Yeah,
We
in
have to
blue, you
bump-
can
oh.
see.
But I meant, like,
We have to bump the ones that are gonna have an impact, and unfortunately, those are the higher dollar ones, so. The people that aren't using the ER, there's a lot of people in our plan. And the idea is to adjust the plan so the people that are the most expensive, unfortunately, are having to pay the most, because we're trying, we're all looking at 1% and 2% and 3% raises every year, and we need to make sure that we're not just eating up the raise on, hey, everybody's got to pay 40% more. But it's tough to go through here and pick out what you want to increase, but we spend a lot of time trying to determine what's going to get us a couple of $100,000, because that's what we're going to need to balance the plan. But it also is good to note that years ago, we probably had these numbers, and with the help of IMA, and we started to build up our reserve higher, we were able to give a real big benefit to the employees and lower some of these, but it looks like it's time to go back
and
the other direction.
employees can opt out too, right?
Correct.
Sure,
Of course.
okay. In case they're on their spouses.
Right.
Okay.
Anything else on this page before we move on?
And then the other piece is the employee contributions themselves. I can say this for certain, I haven't seen, especially a public sector group, keep their contribution levels the same every single year like the city has. And I know it's been a huge catalyst, and I know, speaking with Darren every year, he's always been very proud of that fact. Unfortunately, with the increase in costs, we did want to look at, what potentially bumping up some of those contributions would look like for employees. And so you can see on the medical and dental side, a recommended employee contribution increase. At the very right-hand side, you'll see what that is on a monthly basis, and then per paycheck on a semi-monthly basis. So for an employee only, for example, it would go up about $25 a month, employee spouse $35, employee child $25, and then family $35.
Years ago, when an employee retired, they paid a higher premium than, what was that, a COBRA? And now retired employees pay the same premium as if they were still working here. Would that make any difference in that premium?
It could, but you're also talking about such a few amount of individuals that big picture, it's probably not going to make a big change. And so, looking at just where enrollment falls in now, I don't know off the top of my head how many retirees you have on the health plan, but
It's, no, 4 or 5.
Oh, really?
yeah.
How long can they do it?
They have to get off once they're 63.
Oh,
65.
65,
Available
sorry,
for
65.
state and federal assistance.
It's
so if this is the recommended contribution, can they contribute more if they wanted to?
Could the employees?
Or could any employee?
Not per employee.
Or no, okay, so
No,
it's
this
just,
is-
that's the recommended
This is the
amount.
rates, yeah, and it's, a good question, but yeah, this is, the whole bunch of apples get treated the same.
Is it possible, we're making this switch, trying to make sense of where we're at in our deficit. Is it possible to show like companies, not just the trend itself, for our employees to be able to cross-reference? That way they can see the information and then they'll have a better idea of what's going on.
Yeah.
from what employees are paying from a contribution standpoint outside,
Outside.
yeah.
I think
And
that would
we've
make
done that
sense.
from time to time in the past. We can certainly pull together a benchmark that Kim can use in kind of her open enrollment messaging. We're still much lower than, peers here.
I
Absolutely,
think
yeah.
we can provide some of that information, maybe
Sure.
four of them, then they can see where
Yeah.
we're looking at.
Yeah.
Absolutely. Good point.
Just to tell you, I mean, obviously we can talk to employees about that, but from Kansas commercial wide, employee only, the average is $160 a month. So it's still significantly more than, the recommended $92 that it'd be bumped up to.
It's enough of a change that it's gonna affect the way they look at their raises, to a point too. So, everybody's trying to build their home budget and make this make sense, so.
Yeah.
Understood.
100%. And then really this slide just looks at, with all of these recommended changes, what we've seen in the health plan, where we can anticipate costs to be for 2027, really to kind of right size this ship. We would still be looking at about a $262,000 increase on the city side, which is about 14.4% over the current budget. But with these recommended changes and then the increase listed here, we believe this is that number that'll get kind of the health plan right-sized, and then on a monthly basis moving forward, we're not running at such a large deficit. Yep. And then just the last two slides are, I put together that illustrative tracker with really the new budgeted costs, with the recommended changes, and really this is just a way to show you that this is how that year end would balance out for 2027. So we'd anticipate costs to be about $227 a month, with that recommended budget of $227 a month as well, based on what we've seen on the health plan today, and then the recommended changes with the plan design, network, and contribution shift.
But that doesn't eat the 800,000 that we're projecting for the current year, so we'd have to make that whole. And then this plan should keep us balanced, but that's our hope. And then to Cheryl's point of 30 minutes ago, and then you need to make, somehow we need to consider putting a balance in there and making sure
Sure.
you guys are aware that if we run into a deficit again, then we're into the general fund. We're out.
It's
there's
there,
nothing else
you
in the
hope
health
not to
fund.
use it, but it's there.
Yeah, but good point. And this is this is pretty useful, I think. Go ahead, Nick. I'm
Yeah.
going to talk over you.
And so really I took that first slide and then put the 2026, what we would estimate it to finish at, and then 2027, the illustrative with those recommended changes, what we'd anticipate to happen. And so you'll see in 26, if you annualize that, we'd estimate the plan to run at 3.5 million. With these recommended changes, the hope and to right size this thing is to get it back down to about 2.7 million. And then you can see I kept updating that trend line as well. And so trend every year is 5 to 9%. That's what we're seeing in the market. And so you can see once that dollar amount gets bigger and bigger, that just continues to grow and grow. And so in 2026, that trend line would be up to 5 million. And then in 27, it'd be 5.5 million. So the hope is to continue to kind of combat that trend line from going up every year like we do see in the market.
With the help of IMA, we're going to put together a video for the employees kind of explaining this in 5 minutes and make sure they all, sign off like any other training thing. Make sure they sign off that they watched it. That we don't plan, this won't take effect until January, so we'll get through the budget, see how they come out on raises and things like that before we approach them, but we want to make sure that, they're aware of what's coming, and DJ brought up a good point. You don't want to do it too much, because you don't want to say, hey, you're grounded for 2 months, but your cousin's grounded for a year. That doesn't feel very, that makes me feel better. But in this case, there's a lot of public agencies that are charging way more for health insurance than the city is, and we should be proud of the program we have, but we have a responsibility to taxpayers and employees to make sure that it's in balance. And that's kind of where we are today. Hopefully the claims will go back down, but you guys didn't make me feel too good that was probably going to happen, that maybe this is just the trend and this is the expense of healthcare. So we're kind of chasing our tail right the last part of this.
Well, I appreciate you putting all this together and being able to come up and answer questions towards this too, because it does create a lot of new questions, and I'm sure we'll have more moving forward. But the last thing I have for this is, off this trend, is there some, and I'm not aware, so I'm asking a question the direction I don't have any background, but is there an additional plan or something that would be available for parents that have children with known issues that are going to generate more medical needs? Is there something that could run concurrent with the city's current program that would be available to those families specifically? Not so much a base coverage for everyone, but if they knew, there's pre-existing conditions and common things that they're dealing with, is there something out there that they would be available for, that we could look at as an organization?
That's where it gets a little tricky from like a compliance standpoint and from HIPAA purposes, and you can't really incentivize or steer members to, we could look at, just offering an additional plan instead of just the, $1,500 deductible, maybe look at it like a different plan, but you can't really incentivize or steer members to something like that. I don't know, Christy, if you have any other.
There are, if you have, say you have an impaired child, there are a number of state programs.
Right, there's state programs like the CHIP, and there's other state programs that they could, but from the city's perspective on sponsoring a health plan, typically we would see those, steering those members to maybe one of the state or federal programs.
But currently, you're not aware of something out there that's similar to that,
I mean, the
would
city
exist?
offers accident, critical illness, hospital indemnity policies, so if someone knows they have a big event coming up, there's coverages at open enrollment that they could buy to basically indemnify themselves for extra coverage. So that's being done today. There really isn't any incentive for the employee to go out and buy a separate plan, because it's gonna cost them substantially more than what the city's covering them, and that's the benefit of that employer offering that's keeping them coming back to work every day. So there's a little bit of a misaligned incentive to try to push them to something else. But I think the hospital indemnity, accident, critical illness is really what that's there for. And that's really meeting the needs of people, as long as they kind of think about those things at open enrollment, which of course we promote and hit. But people tend to want to buy insurance when their house is on fire, not before it's on fire. But certainly it's a good thought, and I like the strategic thinking that you're thinking about. Kim, do you have any thoughts on that?
We asked all those questions because we have, I really want to thank Christy and Nick, because I'm pretty sure they've felt outnumbered between Darren, Jay, Katie, Lauren, and I, and Missy, for the last several months that we've been over this, trying to figure out how we could balance it. This is the best recruiting and retention tool that we have for our employees, is our health plan, and we've really tried to keep it competitive for them. So, but we've asked all the questions, and you can't single out people. So,
and not so much in the idea of singling them out, just if there's something available that exists that could be paired with the city's insurance coverage, then if that's something that's trending out there, I don't know. Hopefully, medical catastrophic is not a trending thing we have to deal with in the future, but obviously we're dealing with it now. So.
Yeah, it's a great question.
Well, make sure, thanks to IMA, they've been with us a long time. They're obviously on the stick, and they know their business, and they've kept us in the black for a long time, and they didn't bail on us when we went into the red, or heading to the red. So we'll bring the employees up to speed on this. We'll do a lot, but
any other questions, please still filter them through Kim and Darren. We're always happy to answer them, and welcome to come back at any time. So thanks for having us today. I know we took a lot of time. Appreciate it.
We appreciate
Thank you.
it. Thank you.
Thanks, you guys.
All right. Pathways to Hope. Representatives from Pathways to Hope will provide an update on the program.
Commissioner Sarah, Brian, Kalen, we're here last meeting, and we left them off the agenda. It's not on purpose. So they're back, and they're just going to give their annual update on the important program that helps a lot of people in our town. So thanks for coming, y'all.
Yeah, absolutely. I'm Sarah Elnicki. I'm Deputy General Counsel and Director of Legal Services at CHC. I have Tessa Moody, who also is at CHC, Community Health Worker Brian Dyson, CHC Specialty Courts Coordinator. I think you all know Ms. Height,
Yes.
The city prosecutor. So I will, I've not had an opportunity to come before you all and kind of talk about Pathways to Hope. And just wanted to kind of give you an update and just some information about the program. Program started September 2023, and since then, we've been able to work with a number of individuals who have been come through municipal court and who have pending nonviolent charges. And so we're talking trespassing, those types of crimes. And what the program aims to do is to identify individuals who just need help with an underlying need. Housing, transportation, I think what we were seeing in the courts, what, Mr. Mazurek was seeing before he left, and now what Ms. Height is seeing are people that are, coming before the court with, and having the same issues and the needs, and trying to understand what was really bringing them there wasn't being addressed. And so what Tessa does is when a participant is referred to the program from Ms. Height, Tessa works with that participant one-on-one. She tries to meet with the participant within 72 hours of them coming to court. And then it's a 4-phase program if the participant signs on. And so it's housing, it's ID recovery, it's benefits, it's transportation. Tessa and the participant work together to try to make goals to really remedy the issue that brought them to court in the first place. Tessa, well, since May of 2025, there have been 31 individuals that have been referred to the program. 24 of those had housing issues. Tessa's working with 9 of them currently, and she's housed 15, and only 1. So 14 of the 15 she's housed successfully, and only 1 has returned to homelessness. And so super proud of, the work that Tessa's doing. She works in collaboration with a lot of agencies, local agencies, Crawford County Mental Health, DECA, all of the housing authorities. And so trying to think if there's anything else that I've missed. Rattle off a lot. So that's really just the overview of the program. Typically, participants work with Tessa for about 90 to 120 days. Tessa comes to court every Wednesday. She provides updates to Ms. Height. If a participant is showing up and working their case plan, then they continue to work with Tessa until all of their goals and their phases are met. And then at the end, if they complete those 4 phases, then Ms. Height can decide to dismiss the charges, the underlying charges. So it's a good incentive for participants to, not just pay a fine and then show up next week on a similar, charge. It's really trying to address what brought them there in the first place. So, anybody else?
You did good.
Do you all have any questions for us about the program?
Just the underlying question, there's 2. What's the rubric you use to qualify and recommend somebody for this program?
Good question. So we've actually expanded it within the last year. Originally, it was anyone that had housing insecurity and that nonviolent charge. Those were kind of the 2 criteria. We expanded it, so it's housing instability. We also work with someone with a lack of community or family support. So somebody who is just really kind of out there alone and doesn't really have someone to help them navigate, how they're going to get their needs addressed. And then also those victims of domestic violence, Tessa will also work with them as well. And so those are the criteria. The 15 that Tessa's housed, those just aren't, these aren't just single people. These are people that have families. And so if you think about the impact of housing, 15 people who have families, or, it's a big impact really, and so it started out at housing, but it has, really broadened the scope on the things that Tessa can work on.
And then the other question is just the reoccurring use of the program and being brought back into the program. Is that common, or is it a one and done generally, or?
I'll let Tessa, do you see repeat people?
There's been very few people that have repeated. I've probably seen, in the year that I've been doing the program, probably only have seen like 2 or 3.
Good.
So on the housing, do you work with the city housing department, or?
Oh, yes, I've seen him a lot. I just seen her earlier today, actually.
Yeah. So that's the major issue. It sounds like people without a house, falls in trouble, but you found them places.
Yes.
Is that hard to find places for people that's committed a crime?
Yes, I have a few, probably 3 off the top of my head, good landlords that are willing to give people a chance.
Right.
When they don't have openings, it's kind of more difficult because the major landlords like ProX and Mid-America aren't willing to accommodate as easy as local landlords.
Right.
Who did you say?
ProX and Mid-America?
Brooks?
ProX.
Oh, ProX. Thought you said Brooks, and I was like, oh, I've never heard that.
ProX.
Yeah.
And, Tessa has, I think, worked with, there's been a few that have been really difficult to house, and so I think it's just persistence, and Tessa will, sit down with the participant and, they'll get on the phones together, they'll, really try to identify, if there's a stone to be, turned over, Tessa's gonna try to find that, for someone, so, not easy, but she's persistent.
The last thing I have, I'm sorry, you came and brought up another one. So the individual that gets brought in and referred to this, what steps are they required to take to qualify through this and graduate from the program?
So first, Ms. Height will identify them, talk to them about the program if they, want to work with Tessa. It's a lot more work than just paying a fine and, going about your day. And so then they do intake paperwork with Tessa, and then it's constant communication with her. So it's, weekly, if not daily communication at first, really trying to identify what are the immediate needs. Those are those needs that are going to be dealt with in that first phase. So do they have a place to stay overnight? We will do emergency, hotel stays while they're trying to find someplace. So it's identifying those immediate needs in the first phases, and then it progresses to, do you have transportation to, get you to a medical appointment? I mean, she may get a referral for housing, but then once she meets with people, it becomes a much bigger scope. So it's, hey, you need a mental health referral or a substance use, treatment referral. Those are all things that will be identified in those first meetings. So every person's plan is different. It's not just each person has to do certain things. It's really, Ms. Height, communicating to Tessa those things that need to be done in order for this person's charges to be dismissed.
So that 90 to 120 days, you're seeing these people probably more than 10 times roughly? Is that
yes.
average?
Yes.
So you said I forgot the numbers that you helped, but there was one you couldn't help. What happened to that person?
It's not one that I couldn't help, it's one that came back into homelessness because of failure to maintain the housing. Basically, this person relapsed, and they ended up becoming back into homeless and back through the system.
And then they go to...
If they get more charges, they would come back to her, but this person specifically hasn't got any more charges.
Thank you. I appreciate you
Yeah.
asking that question. Sounds like the program's working. So
Thanks.
Thanks.
Sorry for the mishap last time.
Oh, that's okay. Thank you guys very much.
Thank you.
thank you.
All right. City manager submitted budget. City manager Darren Hall will present the city manager submitted budget for 2027.
Mayor, commissioners, you should have a notebook in front of you with a picture of the College of Business, the Research Road, and I think that's J.C.'s ball field, what it's gonna look like next year. So yeah, usually I read my letter, but this year it's 2.5 pages, and I'm just not gonna read it. So it's in there. This budget will be posted tomorrow morning, on the website. But I will give you just a kind of a brief recap. We've spent a lot of time this year. You guys are familiar with the budget calendar and everything that we've added to it. And as is the case, for the past several years, we're obviously facing increasing costs to operate the city. We're blessed this year with a finance director, not just a finance director, but a new finance director, and she's very skilled. So she's brought a lot to the table with putting this budget together. She was also provided a new financial management system when she got here that was just getting started. So between her and Jay and the most of the department heads and a lot of the users have spent I don't know how many hours on that new system. It isn't live yet, but we were able to take the budget and put it into the budget module. And so the budget that you see in the notebook, there's 2 budgets in there. The first one is the state budget, which is, we talked about it last year. That's the actual certified budget that you pass. It sets the mill rate. But in addition to that, there's a line item budget of the entire city's budget by department, by fund, with actuals and estimated expenditures for 26 in the budget. So you can go through there, and that should hopefully lead the next 5 weeks of budget discussions because you'll have full detail on everything that's been in there. We have a new budget process. Like I said, we've met, all the department heads were in here for 3 months, giving presentations. We've kind of just started from scratch. Throughout the old system, Missy had to take the old system, which was an Excel spreadsheet that caused a lot of grief last year, and basically met with the department heads and just said, okay, what are our revenue goals? We obviously wanted to reduce the mill rate. We didn't know what assessed valuations were going to be yet, so we met with a couple things we never did before. We met with the county twice. We met with the school district once. County clerk has presented to us on what the assessed valuation is going to be, so there should be no questions about what that is. So using those numbers, we kind of just built the budget from scratch, brought it back up. We did address several major things. We did reduce the mill 2.152 mills. We will not exceed the revenue neutral rate if you stick with the budget that we submit today, which has never happened before. We did manage to get 3% employee raises in here, which was not easy. And we addressed the imbalance of the employee health fund, which was referred to, we talked about for the last 45 minutes, with a 15% increase on the taxpayer side of that to help close that gap. And then, of course, the employees, you saw what they're going to face with their pays. The pay set. But the idea with the pay is when I got here, we were increasing, the health insurance was going up 18% a year, and we weren't giving raises. So that was not a kind of environment that's going to attract a lot of employees. We've turned that around. We want to keep that momentum going forward. This budget has a huge major emphasis always on public safety and infrastructure. We balance the general fund by reducing the operational cost by 1/3, which is a big number, and support services by 1/2. So I think that number was just under $1 million. But when you put the raises in, that's about $400,000 in the general fund. And then when you put in the reduction of mills, a mill this year looks like it's about $182,000. So over 2 mills is $360,000, a little more. You're looking at about $800,000. So we took you to your directions you gave us and said, okay, we've got to get serious about not just reducing the revenues, but we've got to reduce something on the expenses side too. So we've put that in there. We'll see how it plays out. Once again, this budget is being put together in July and August, and it'll be effective through next December. So a lot of time between now and then. And one of the things that we did on the balancing was a lot of times we transfer ahead of time from the general fund into the other funds, anticipating losses. It's hard to keep the pool in the black. It's hard to keep, parks in the black, the golf course in the black. But we pulled those transfers out and have just held those back, and we'll make those transfers at the end of next year if we need them, rather than just taking them out of the general fund now. So Missy's brought a lot to the table on just making sure that the jump from the spreadsheet to get loaded into the new system, and then from the new system get balanced, and then when it was balanced, we had to use it to tie out the state workbooks. There's a lot in there, but it's amazing what you can do when you have talent in your office, and her and Jay have really led the help, and Kim sat through more meetings. She was wondering why as HR director she was sitting in all the budget meetings, but I had to have somebody else in there. So everybody on the executive team has stepped up, and everybody on their staff has really done what we've asked them. So Specifically, we did reduce or cut a few services. The tree removal for the $100,000 per year that we've done the last couple of years has been removed. The demolition of dilapidated structures is traditionally funded $100,000 a year. We took that down to $50,000. I don't think we can do away with that program, but it's a very popular program. It keeps our town looking good, but the money has got to come from somewhere. So this is our submitted budget to you. We have a meeting on August 11th. We have a meeting on August 28th, and we also have the budget meeting where it needs to be passed on September 8th or 9th, September 8th. So we will not have to have a revenue neutral rate hearing, which is kind of nice. That tells you how, that means the revenue neutral rate was set. That's the level with the current evaluation and everything in the budget you're putting together that would give you the same tax dollars you had the year before. So the fact that we're under that means that we are not using more. I think we're actually down about $250,000 just on the tax sheet when you show that about what our mill increase. But if you think about a mill, we're down 2.152 mills this year. What it would have generated, it's over $370,000. So I really appreciate the work. It was just a new approach to the budgeting for us. You know, we kind of do what's necessary, and obviously it was necessary just to dig into this. And it's very important to note that we have a new financial management system. We have a new finance director. We're in a much better place. The reports are much better. The information you're seeing is coming out of a system now rather than coming out of a spreadsheet. So we have a lot of confidence that the numbers are good, but there's still a million decisions to make, and it's your budget at this point. We're here to help you. So tell us what you want from us. Please read it. And like I said, we'll have it on the web tomorrow so everybody else can read it. It's pretty straightforward. The reports will get better and better each year, but like I said, the system is not even live for another 2 months.
Actually, next month.
So next month, so we're coming in on it, but we were able to get the budget into it, and with that, traditionally we just give it to you and get on to it next time. But if you have any general questions, I know we've got a pretty big agenda, but we are happy to present it to you. We're happy it's down. We're happy that property tax is down, and we're happy that we could get 3% raises in there because obviously the cost of being an employee is going up as well.
So to be clear, that the two primary things that were cut were the tree service and the dilapidated housing was reduced. Those are the two main areas that were.
No, we cut $1 million out of the employees' support services out of the general fund, which is travel, equipment, things that they buy for their office, training, contract services, professional services, support them doing their jobs. Yeah.
2.15 is very close. Obviously, I was hoping we would get closer to a full 3%. I guess we'll have to look closer and deeper to try to at least get that to a starting point. This is recovering some of the complication from last year's budget that was overlaid and some of the issues with the increase. So to Roger's question earlier, reduction in spending, not just usage of the reserves and cutting services, and the availability. So yeah, we've got more work to do for sure.
I just say the 2.152 mils reduction is a start. I know each department came with their wants for several different commission meetings, and we're going to have to take a look of what the wants are compared to what the needs are, and hopefully we can reduce expenses with that also, because I think we need to do that, look at it closer and see how much more we can reduce. But it's a start, you know, and we can go from there.
I like how we brought the budget meetings out in front for the public to actually be a part of and be able to see and go back and view. I think that's a big step towards trying to get this balance and actually make it make sense to where the money's going, where it's coming from, all the revenue sources that are, you know, flowing into the city, and then providing an explanation of where they're flowing out of. I would recommend or ask for next year's budget. I know you're following the statutory requirement to submit the budget to the commission, but something of this magnitude with the new system, I'd like to see the commission get this maybe at least a week prior to this meeting, so we have some time to go through it. And then we can have some questions and some more back and forth for this date. Is that something we can do?
I guess the question is, how many weeks do you want to have the budget between when I give it to you and when you have to pass it? Right now, you get 5 weeks. If you want it 6 weeks or 7 weeks, I mean, just tell me the number and we'll.
Well, just primarily with this date, you know, it's the first time we're seeing this. I know I've asked you some questions throughout the last several weeks about specifics in the budget, and I haven't seen it yet. So what I'm asking for is this: if this product's created through the module and it's available, can we get it a week before this meeting? So today, next year, we can have a better discussion over it. We've got a pretty heavy agenda, I agree, and there's a lot involved, but this is probably the largest item in the agenda today that people want to know about. So just having your commission more aware. And
You have to get the budget at some meeting, and this is the meeting you chose. If you wanted it a month earlier, you know, you just have to tell me. You have 3 full meetings coming up to talk about the budget, so if you don't, I mean, we can give it to you. What meeting do you want it? I mean,
well,
I have to give it to you at a meeting. You didn't get it earlier today because today we were still making changes to it and printing the books.
Right,
I mean,
so
it's just like a term paper. You work on it till you have to give it out. So if you guys let me know when you want it, I mean, I can't give it to you before we get the assessed valuations, but, you know, we get it to you when we're out of time and we have to give it to you. If I could have given it to you 2 weeks earlier, I would have given it to you at the last meeting.
What's the latest you can give it?
today.
The latest you can give it is, I can give it to you whenever it's ready. I mean, the date that matters is the day that you have to pass it by September 8th.
By September 8th?
Yeah.
Okay. All right, so we can get it anytime between now and September 8th, as long as we have enough time to go over it.
We could get it to you in March but it gets better every, half of the budget is an estimate of what the current year is going to be, and we're taking off from that year to do next year's budget. If we do it before June, we don't even have half of this year to estimate off of. Right. So the budget calendar is driven by how long it takes to do the budget, how long you want to go through it. You have 3 full meetings, and any special meeting you want to call to sit in here and talk about the budget. So it's not late. We gave it to you when it's been planned since January to give it to you. If you want it earlier, next year will be a lot easier to do, but it's just like a term paper. We just get to it when it's ready. I know you wanted it a week ago, but it wasn't ready a week ago.
That's primarily why I'm asking this. It's a new version of the budget, a new view of it for the whole commission. So if it's possible to get this, and I'll restate it, a week before this meeting, just what you have here, and if there was eaches, then annotate and let us know those eaches that are not completed yet, just to give us time for when you do, we're discussing it.
Yeah,
so.
The budget's, if you're asking for a 4th meeting to have the budget so you can discuss it, we just need to move up the calendar.
No, I'm just asking for the budget to be submitted to the commission for review prior to this meeting.
That's not going to happen because we're going to present it at a commission meeting. And when that commission meeting is, we are going to work on it until then. There's still work we could have done in this budget, but it was due today, so we made sure it was balanced and we kicked it out. But if we had another 2 weeks before the next meeting, I'm sure Missy would have come up with 100 other things that she wanted to do.
So technically, we could have a special meeting to go over everything here too.
Yeah,
right?
you can do, I mean, you have 5 weeks to go over this budget. And if you want 7, we can give it to you the first meeting in July, I guess. But what I'm saying is, I'm not going to kick it to you on a Sunday a week before the meeting when I'm going to give it to you, because we're going to keep working on it until we're out of time.
So
I didn't sit on this for a week.
I'm not saying
This
you
is
did.
due today.
I'm just saying if it's possible to get a copy of it before you present it to the commission, like we do almost everything else, then it would be beneficial for us to have time to review it and then have this back and forth discussion.
What's the point of submitting it at a commission meeting then?
Every other agenda item this has a 5-week calendar on it and 3 formal meetings for you to meet on it. You're not getting it late. You're getting it when you have 3 meetings to work on. If you want to get it where you have 4 meetings, just let us know and we'll do that. But it's not like we were sitting on it last week going, hey, this is cool. We could have given it to the commission. We literally have spent nothing but 10-hour days balancing this budget, trying to cut out the money and get the services where you wanted. So yeah, if you want it earlier, just tell me, and we'll try to bring it out the next meeting.
Well, when we got the packet agenda Wednesday, was this finished then? Could we,
Nope.
we're gonna have had it?
We have had July 28th on our calendar since January.
So this just got finished today?
I've made changes to my letter today.
All right.
And I don't think Tammy is very happy with me because she's printed several versions of this just today. And that's one reason you've got it in a notebook now, because we were making so many changes at the end that it was like binding that thing and it's impossible to change. So this is a much friendlier working document. I think you guys have 3 full meetings and any other special meeting you
And the
want to have.
paper
to go
wasn't
over.
warm either.
And the
It
paper
wasn't hot
wasn't
off the
warm.
press.
And it says submitted right across it, so, yeah,
It's
I
not
appreciate
gonna
this.
be like, next meeting, you're gonna take this away and give us another.
It's your budget, Chuck.
Like happened last year, hopefully.
Well, then that's my question.
So do you guys want to have a special meeting to go over this?
We may need to, yeah. I need some time to go over it, since this is the first time I've seen it. But that may be beneficial.
You're not being asked to adopt it, you're aware of that, right?
I do.
You have 5 weeks and then some change. And we're happy to
But
come
see,
in.
just like last year, we don't want to wait till the 5-month mark that he said about why are you asking questions all of a sudden? So if we went ahead and had a special meeting and asked the questions all the way through, without the employees feeling like this is all new to us too. So like, just want to know and ask
Okay,
questions and be able to have a
How
good
many
dialogue.
meetings between now and the time you have to submit the budget?
There's 3 planned, but you can have 18.
No, I mean, how many total meetings are we gonna
You
have?
have August 11th,
3 or 4?
you have the 28th, or the 25th. I think that's 14 days. And then you have September 8th, when you have another formal hearing.
4 more times the budget could come up. Here, in a meeting here.
3 more.
3
So
more.
do we need a special meeting?
Well, that's up to y'all.
I mean,
Sure.
we haven't even had one meeting since we just got this. So
Sure.
how do we know that we need a special meeting if we haven't?
Well,
even
that
had
way
one?
you are able to go through everything and they talk about everything that's in here. And, yeah, we can see where it is
My
that,
sole concern is that we don't have another 2026 budget and so many changes, and that's why I'm asking this. So if we had a copy of it, and again, if the changes were, in the data, then I would feel differently about it right now. But if it's solely in a statement or your letter to the commission, to the city, then we could have had some of this information, yes, last week to review it, and then today we would actually know if we needed a special meeting or not, or at least get closer to that. So I'll review it and we'll look through it and we'll go
Well,
from there.
let me give you a better timeline. Today's Tuesday. On Wednesday of last week, we got it, and when did we put it into the new system? And it was imbalanced and not balanced. So a week ago, we finally got it into the new system, which is pretty Herculean task since it was a brand-new system and she had to do an entire new chart of accounts. At that point, we can run a total and see where we are. And of course, it was way out of balance. So by, I think Saturday, or I think Friday, we were sitting in Missy's office at 1 in the afternoon and we all looked at each other and said, okay, it's balanced. Then Missy tried to start putting it into the state workbook, which is a way to check it because those two have to match, and the state workbook is actually what's submitted to the state, and it wasn't in balance. So we had to go back and spend the weekend trying to get it in balance. When was it finally in balance, do you think?
I think it was Sunday.
So Sunday. So had we given it to you anytime last week, we would have repeated last year where we were like, hey, that's not the right one. So this is the right one. This is as soon as we could get it to you. Next year, I'd be happy to try to get any calendar you want and get it to you whenever you want.
So you said Sunday it was,
Sunday, I think it was probably,
so you could have gave it to us in the packet.
no, because Sunday afternoon, we balanced it, and then we had to make it. This isn't, we asked you for software when we had our budget hearings to put a book together, and we were told, we're gonna cut back, we're not gonna do it. So this is handmade, this is a combination of the state report, a combination of Missy's system. They have to be balanced together. Hopefully they are. That's what we spent the last, yesterday, we ran around and tried to get the book presented. Today's Tuesday, and today we made a lot of changes cosmetically So it actually looks the way it does, but
Missy,
I think
so
it's-
to
I
that
think it's
effect, are we gonna see additional changes to this moving over the next
Not
couple of weeks?
unless you
in the next
ask us
meeting?
to make those changes.
this is the submitted budget. We're done. It's your budget now.
Yeah. I think probably to put things in perspective here with the new system, we thought because we can get reports directly out of the system, instead of me having to run an Excel spreadsheet and hope that the formulas didn't get mixed up or anything like that, we thought we made a choice that we would put this information into the system and let the system run the reports. Okay, that still doesn't map into the state documents. So first of all, the accounting system, the numbering system is different from the old system to the new system because we made some improvements to that and the mappings are not the same. The numbers are not identical. So not only do we have to bring it into the new system, we have to put new numbers, we have to identify the numbers that it maps into. So I built a mapping document, a crosswalk, and I had to bring that in. I had to crosswalk the numbers. I have to sort the numbers out. Then I had to dump it into an import worksheet, and then I have to dump it into the system. I had to do that, and then we couldn't do that until we got the system. They had to bring in the system actuals, or you wouldn't have had actuals. They had to bring in our actuals for 20. I said, okay, if you can get me budgeted 26, if you can get me budgeted 25 and actuals 25 in the system, in the new system, then I think I can import the others. So then I had to import in the projected 26, and I had to import in the budgeted 27 numbers that we had come up with. I had to take those from an Excel spreadsheet that we had created to start with, and I had to map those over into the new accounts, and then we had to upload those in the system. Then we had to make sure that they uploaded correctly. So it's not as easy as you key this. So you can see that from the back part of this, from pages 30 all the way to the back, except with exception of the payroll information. So from 30 to 119. So what is that? 80-some pages? 80-some pages that, those are account numbers that we had to check. And I had my staff checking those while we were working on the budget. So it wasn't as easy as you think. And most people, if I hadn't had a lot of experience doing this before in my previous positions, a normal person wouldn't be able to do this.
Okay. And the only thing that will change now is whatever changes you want. If you come back and say, hey, give us a scenario where the raises are 2.5 or 4.5, then Missy can run it. We can do that one week. If you want to come in here just one week and have all the department heads here and go through line item, we can do that. We will not change, this is the submitted budget. We will change it according to what you want to see in the final budget over the next 5 weeks as you direct us. I can't be any clearer than that. And that should be a lot easier this year with it in the new system than it was last year off of the spreadsheet that we thought was right that had.
Right.
Missy trashed that.
I think the other thing you need to know is that there's not a perfect way to get this data into the state workshop, or the state worksheets, okay? So what I have to do is, luckily the new system does give us some good checks and some good ability to pull the data and dump it into Excel and check our numbers and see if that works. But when they say general fund in the system, the general fund is Fund 100. When you go to the state worksheet, general fund is Fund 100, Fund 215, it's a whole slew of funds, 180, which is the healthcare, those all, the state considers those all general, when we only consider 100 general. And so there's a different way that they line it out and consider it versus how we have it in our system. So it's not as easy as, you're not gonna be able to go, okay, well, I got general fund here and it's gonna tie here. You're gonna need, if you need me to work through this with you, we could pull up the system and you can see how I run the reports and I dump them in so I can check them manually. So we went through this a lot. I went through it a lot and Jay went and checked my numbers a lot. We spent a lot of hours on this because I want to make it right. I want to make sure that the numbers are in here, the numbers that are here map over to here. Okay?
Nobody's saying that any of this is easy, and I agree, you guys are working very hard to make this make sense and make it right. The software that was in the package that was approved last year did have this module to run budget and reports, and again, you explained that it doesn't tie directly to the state documents. And that's why essentially the commission didn't approve additional software, because we had existing software that was already in the new system. I know it's been difficult to get it running. My concern is just the time of having a new view of this budget and how things are being generated. Nobody's discrediting anybody's efforts and time in this. We just,
Thanks, Missy.
the commission wants to have a better view and understanding of that process, so I appreciate you offering that up, and I'll definitely be in your office to come.
Well, wait a minute, I think it should be all of us, not just one-on-one. And if this is the playbook, so to speak, I want to hear it from you. I want you to help us understand everything, not, in due time here, but I want to understand it better, because I want to make sure that we're doing what we can to cut expenses for the best option for the city, but not cut employee benefits and pay and, or fire and police or anything like that, but I want to understand it. And if you would be gracious enough to do that, I want to have a special meeting. I want us all to hear the same information. I don't want to go one-on-one.
No.
I don't think it's fair to us, and it's not fair to her, because it takes up her time when she can say it once.
I like what Darren said a while ago. If we want each department to come in here and show us, whatever that was, 2.152, show us in their budget what their actual needs are and what their wants are. I'm sure we can find some more ways to cut expenses. And it's gonna take another meeting with that included, I think. Just go through department-wise and say, hey, what do you see that we could cut?
And I want it to be where nobody's on report. I just want to talk.
Why don't you just have,
I want people to understand that we're just like you guys. We just want to help us understand.
we want you to understand. There's a meeting on August 11th, and there's a meeting on August 2 weeks later. Is that, why don't you just make the August 11th meeting your first meeting on the budget? You're still a month ahead of when, you can have a special meeting, but you also have 2 entire meetings.
But if that's all we're talking about, the special meeting will be just.
If you put the 2027 budget on the next meeting agenda, our meetings are already 4 hours long. You can just do it that night. We'll just do the regular business, but that's the whole point of.
As long as we can get all of our questions answered and go through it, not hurriedly, but I'd love that, Missy.
You have 2.5
Do it at
weeks.
4:30 and do it outside of the agenda.
I would ask go through the budget and make some notes, and if you could email me that ahead of time, I will be better prepared to answer those questions, so.
Well, see, that's one thing too. I want to be able to pick your brain. I don't want you to be like you're being graded. I just want to know.
You don't want to pick my brain.
No, I just don't want you to feel like, oh, she didn't get that one right, or I don't want that. I just help me understand what it is that you're talking about.
Okay, that'd be great.
And that's what this is all, to me, that's what this is all about. Just like when they were explaining about their HOPE program, and help us understand everything that's going on, because ultimately we sit up here and make the decision, and we want to make sure it's the right one. Just like you do.
I'm coming up on a year here in September, so not quite been a year. But it takes a while to get your feet wet and to kind of understand
tell me
things,
about it.
because things are, I did fund accounting for only a year before I come here, but I've had lots of other experience counting and software implementations and stuff like that, but and auditing and that sort of thing. But this is a new way to think about things. You have to almost re-engineer your brain to think fund accounting versus regular accounting. So I understand that.
Sure.
So I'm just now getting to where I
still want you to say hi to me at Walmart, okay? But anyway, thank you.
With all the questions about the budget, I know you guys need to answer to us. Well, we have to answer to the taxpayers, and we need to get the answers they want asked. So, if it takes 4 hours for a full meeting, it takes 4 hours.
Or 2 4-hour meetings. My point is you have 2 full meetings to spend as much time, and if we need another one, we can do another one.
I think it's very obvious we all care, for sure. We all care about it, so Otherwise, we just say, oh, done, okay. But I appreciate you, Missy, thank you.
So, do we need to make a motion for the next meeting to have that on the agenda?
Or no, just,
No, we can just put it on the agenda.
All right, sounds good.
and it really doesn't need to be any earlier, does it? Just as long as we're discussing it? Or does it?
I think the intent is to have ample amount of time to process it, get the direction from Missy and the staff on how they came to where they're at now. And obviously, if it was still a product being worked on until today, then, you know, there are things that are gonna come up moving forward now that we have a product in front of us. Just more open communication between what you're doing, how it's done, and how the commission can help and be a part of it moving forward, so.
All right. Consider the following, Height Law LLC project. Consider the recommendation, Economic Development Advisory Committee to allocate up to $40,000 from the revolving loan fund to support the request from Height Law LLC to renovate the property at 919 North Broadway.
All right, good evening, Mr. Mayor, members of the commission. Here to bring in recommendation from the EDAC that is consistent with past recommendations they've issued related to building improvement projects. This property specifically relates to 919 North Broadway. I think most of our residents would associate that with the corner patio property. This does include the corner patio, but as you're about to hear, the focus of the redevelopment efforts is really just to the east of that, which were some former motel properties, I believe.
West.
So
West, right?
West, yeah, sorry, yeah. Yes, thank you for that correction. West, that will become the new home of Height Law. So to tell you a little bit about this, I'm going to turn it over to Kaylin. And Kaylin, you can scroll through your presentation with the down arrow key there.
Give it a try. Hello again, I'm back. Good evening to the commissioners and Mayor Munson. So as I already kind of mentioned earlier, my name's Kaylin Height, and my husband and I purchased 919 North Broadway back in November, and as Blake said, it consists of the corner patio and then goes back east. So it's it was previously a 5-unit motel that was built in 1930, and so it was partially remodeled. The previous owners, it currently holds 2 single-unit Airbnbs that are active and running, and then the corner patio, which was completely redone and is also up and running. So I came to the ADAC to request assistance in remodeling the back part of the building to become my law office, Height Law LLC. And so for those of you who don't know me, Kaylin Height, I grew up here. I grew up in Cherokee, Kansas. I'm a very proud Southeast Lancer. I went to Pitt State, then I went to Washburn to get my law degree, and I always knew I wanted to come home. I have been fortunate. I've worked with 3 of the law firms here in town during that time, either during or, well, actually before law school, I worked with Wheeler and Mitchelson. Through law school, I worked for Spigarelli's, and post-law school, I worked with Fleming Law Firm. And then October of last year, I was fortunate to become your new city prosecutor. So, I do that on the side in addition to my private practice. And then in April of this year, I decided to try to hang my own shingle. It's currently just my kitchen table, but it's working so far. I'm also very involved in the community. I'm a chamber ambassador. I'm an executive member for the chamber. I'm secretary of Sunrise Rotary. I'm a PEO member, and I was a 2023 Woman of Distinction. And this May, I was surprised with Volunteer of the Year. So it's been a very, very busy year. And I am married to my husband, Sean Seamatter, who he coached at St. Mary's Colgan. He was the head football coach for 9 years. After 13 years in education, he decided he should make a career change, and so he switched it up, and now he is a recruiter for the Crossland Kickstart program, recruiting high school juniors and seniors to participate in the Crossland summer internships. So point being, we're very involved in the community. We're ingrained. We're not planning on going anywhere anytime soon. And so last fall, Sean and I, we rarely get to, with his working in the classroom, we never got to go to lunch. Well, we happened to one day
we had both seen a Facebook ad that the corner patio and the attached property was for sale. We were not looking for property, and we looked at each other and we thought, well, maybe we could pull that off. And so by the end of the week, we were signing a contract to purchase the building. And again, we weren't looking. We just thought we couldn't pass up an opportunity to invest in something. And I told Sean multiple times, just the thought of owning something on Broadway, my hometown, put a sparkle in my eye. And I didn't know what that meant, but I thought that meant we can't pass it up. So we went for it. And so like I said, the building was built in 1930. This is what it looked like back, I believe, in 2013. And so the previous owners, they did put a lot of work into it. Here's what, oh, I'm hitting the wrong button. Here's what it looks like now. And so they completely gutted the building. They did some framing and they put some electric and plumbing. They started that, but we need to finish it. We need to restructure walls. We need to level out floors, adjust the plumbing, install more lights and HVAC. And so what I'm focusing on is that back west portion. So units 3, 4, and 5 is what we will be remodeling. 1 and 2 already holds the Airbnbs that we currently run. And then obviously the corner patios in the east side.
You said 1 and 2 are Airbnbs?
They are, yes.
Okay.
The previous owners created that, made them, they're really great, and people, we just had, all summer, we've had someone almost every weekend booked. So it's fun to see who comes to Pittsburgh. So we want to keep those going. And we intended to finish it out as Airbnbs until, again, one of those things, I just kind of thought, well, Sean's changed his career. I said, I'll go ahead and try and change mine. And so in April, I left Fleming Law Firm, and I thought, well, why pay rent in another building when I can just remodel a building I already own? And so this is where we're at when we purchased it, kind of what we're looking at. They did a lot, but there's a lot that needs done. And so height law is what I intend to obviously put in the back units. And so talking the numbers, the actual purchase price of the building was $325,000. I'm not asking for any money to make any changes to the corner patio, and so I thought it was fair to remove that square footage from it. And so regarding what I presented to the EDAC was a purchase price of $250,000. And then after speaking with, we've talked to a couple businesses in town who've given us bids, quickly realized how expensive remodeling a building was, definitely higher than I was expecting. But we're still shopping around, but the numbers that we've consistently gotten were around $150,000 to finish out the last 3. And so I kind of broke it down here to what we're expecting. And so my total number is $400,000.
And so your office is going to be the part of the building that's adjacent to the roadway?
The back, yes. So what you see there is corner patio 1 and 2. And when I go down, I rotate it west. So that's looking west.
You do away with doors and windows at all, that those remain and then different access, or it's just?
What I intend to do, again, because I want to keep the integrity of the building. I don't really want to break down too many walls. And so I intend to leave those doors as is and potentially just put a giant awning over, because those back 2 would be entrances potentially to where my office is, and then like the entryway conference room area. Sure. But so overall, again, I grew up here. I went to law school to become a lawyer, and I knew that in the end I wanted to come back to my hometown. My law office is a general practice, so that means I try to do a little bit of everything. I kind of refer to it small town law, because I get fulfillment out of being able to pick up the phone and help someone's teenager who got a ticket for the first time, or someone who's going through a divorce, or someone who needs help with a will. And so I love to be that person. And now I get to be that person and operate out of a business that we own on Broadway. But now I have to turn to my community and ask for some support. And so I requested from the EDAC reimbursement of up to $40,000 for the remodel of my 919 North Broadway.
And I will add, Commissioners, there were lots of things the EDAC liked about this project. First of all was the fact that, as Kaylin said, she wanted to make this investment in her hometown. In fact, I think she opened her presentation to the EDAC that she always wanted to own a business on Broadway. Secondly, if you look at the trends, communities of our size are having trouble attracting young private practice attorneys. It's becoming more of a challenge. So to be able to invest in a private practice attorney that will be here for several years was something that was also very valuable or attractive to the EDAC. So with that, we'd be happy to answer any questions you may have.
Well, I appreciate that you've invested in yourself and your marriage, and you're giving back to the community and wanting to do something to help, revitalize. I mean, growing up here, watching that facility and the condition it was for decades was hard for people to look at, and knowing what it was. It was a liquor store many years ago, and a daily rental motel. So seeing it evolve into something like this, and the previous owner did quite a bit with it too. It made it less of an eyesore and more appealing to everybody. I think it's great. So, you have anything, Doc?
I have a question. Since you're the boss lady, where are you going to park at?
I know, that's the one, there really isn't, we do have great parking there. However, I'm not gonna be able to hide, so people are gonna know when I'm at work. Park at the corner patio and sneak up.
You're going to have a great lunch spot for all your lunches.
That's right, and coffee.
Yeah. Anybody else, motion to approve?
Second.
Been a motion and a second to approve.
As a very proud great uncle, I'm gonna say this. To avoid any conflict.
Yeah.
All right. Been a motion to approve and seconded, Stu's abstaining. All in favor say aye.
Aye.
All opposed, same sign. Motion carries.
Good luck.
Congratulations.
Thank you.
Very cool.
Eagle Picture Technology, final change order number 12. Consider staff recommendation to accept final change order number 2 for the Eagle Picture Technology LLC project.
Mayor, Commissioners, so items B, C, and D are related. B is in fact the final change order. Looking for your approval of that. The next one is the final pay application, which will final out the project, all in preparation for item D, which is the purchase agreement between the city and Eagle Picture, which authorizes you to take that action, to have us take that action this week. So we would close on the project. I have Lee and Dan, you just gonna talk? You got it covered? Anyway, we have Eagle Picture here if you have questions, but we can take these one at a time, but they are all three related.
Good evening, thank you. It's excited to be here. Really appreciate the partnership that we have with the city of Pittsburgh, and we're looking forward to as we expand our footprint here with our second location. As Darren mentioned, we're interested in finalizing the purchase there. I know we initially entered into a lease agreement, and we're looking to accelerate that and pay off the building now.
Yep.
I guess I would ask you to explain that. There's a lot of people in the community that have reached out since this agenda was published. They're not understanding how the process is working with the lease being reduced in time and the purchase agreement. So if you could just briefly explain how this is working and what your intent is.
Sure. So, first of all, appreciate the willingness of the city to, for lack of a better way of putting it, put your money where your mouth was last year and help us move forward with this project. Eagle Picture is in a different place this year than we were last year. We've had some business changes. Everyone knows the world is in a different place. So we are a battery manufacturer, sole source on 90% of the munitions with our U.S. Defense Department. And so our business is strong, and we're looking to really accelerate what we're doing in that building, get that building up and running, and we're in a position where we can, I think we can take more ownership there and hopefully make it a beneficial situation for the city too.
Any other questions?
Move to accept
Second.
B, C, and D in toto.
Can we do all three, or do we have to read them all?
I would suggest you do.
Okay, so that's just for the first one, Doc, item B. Your motion?
I second.
Second, I'll say, all in favor, say aye.
Aye.
All opposed, same sign. Motion carries.
I would move to approve C.
Second.
Moved and approved. Motion to approve and seconded to approve C. All in favor, say aye.
Aye.
All opposed, same sign.
I'm sorry, Mayor, I think Henry wanted you to.
Oh, read it?
Yeah.
You have to
Do we
read it?
need to go back and read item C?
No.
Okay.
Okay.
Same thing with D, or you want?
Got a question. What's,
D is, you don't have to actually read these, you know, we've got a published agenda. It's just typically we do it for the public's benefit.
We made you do that because we're ornery. No. You got a question?
on this D, what's this paper compared to our packet?
There should be two changes. One is the title company.
Okay?
It says, I think, Chicago Title, and they sent one over today that says Security First, I believe.
Oh,
The second one is the original 7.9 didn't include the payments already made, so they adjusted the amount to, I think it's 8 something, to reflect the payments that Eagle Picture has already made to the city over the last 6 months when this thing started.
Okay.
Those should be the only two changes. Jamie's given
So
me.
this trumps
The one you were handed trumps the one in the
Yes.
packet for sure.
move to approve.
So what was the motion for?
I wanted to know, we were handed this,
She said-
and I want to make sure this trumps our packet
Okay, but your motion was
to approve
to approve
item D
D.
on the new change.
All right, so that's what we're talking about right now.
Mhm.
Motion and a second?
Yes.
It's been moved and seconded to approve. All in favor, say aye.
Aye.
All opposed, same sign. Motion carries.
Thank you.
Thank
you
you.
for coming.
Good luck.
Thank you.
All right, Mammoth Sports Contract, LLC agreement, addendum. Consider staff recommendation to approve the addendum to the agreement with Mammoth Sports Construction, LLC. To add additional scope of work and to modify the payment terms of the agreement.
Mayor, city commissioners, you guys keep sneaking up. Take it away, brother.
Sorry. As you know, the Don Gutteridge project that's going on with the turfing and everything, started with the bond issue you guys approved, and it was gonna do the 3 infields at Stice, Cardino, and Wild Red Berry. Then we got a private donor that went in to do all of Stice. And on April 28th, we went into contract with Mammoth to do those. And since then, we've had, obviously, more donors step up and everything, and the scope of work has really expanded to actually including, we're gonna be doing all of the sports turf, or all of the field, that's the wrong one. And so this is what Stice is gonna look like, and here's Carnino. But we're gonna go in and we're gonna turf all of the fields now, with the scope of work changing to that. And then also JC Ballpark is getting new infield and outfield. So what we're asking today is just to assign the addendum, because we're changing the scope of work with Mammoth from the, just the new contract with them on top of the April 28th one we had there, because the scope of work has expanded.
This will include the turf,
And the fence, new fencing.
what's the, what do we call it?
And then the stabilization, yep.
And Blaze is here with Mammoth. He's,
You got anything?
come on up, Blaze.
Yeah, I have some questions on, what we have in this book, is this just a rendition, or is that what the fields are gonna look like? And the reason I ask that, Cheryl Stice and Ted Carnito, the infield are brown, and then Bill Russell, what else, Dale Connor, Jim Kelly, they have a green area. Is that how they're gonna look, or?
Well, so this is what Bill Russell, this is the actual picture that's gonna be. There, it's gonna be the brown. See, Wild Red Berry, we're adjusting the fencing a little bit, it will also have the green turf. So the only two that will have green turf on the infield are Wild Red Berry and then JC.
And what's the reason for that?
For a baseball. It's more
baseball,
of like
that's baseball
yeah,
field?
more of a showcase baseball.
Okay.
Kind of like the championship.
Oh, okay.
And then the rest of them is gonna be the brown infield, to make it more universal on there. Sorry.
No, typically softball fields are brown infield.
Is that what JC's gonna look like then, with this baseball?
Yeah, JC pulled up.
This. Oh, let me see. That's JC, what it's gonna look like with the extended bullpens and everything.
Yeah. So baseball's got that look.
Baseballs have a green infield, yeah.
Yeah.
And then this will be Stice, this will be the, if I can get.
I had some other questions, but it's on in the back of this book here.
Well, I thank you for allowing me to be here for the third time and enjoyed sitting in these city commission meetings. And
Yeah.
that booklet, what we did is we put I asked them to put that booklet together. The easiest thing to do had been just rip up the old contract and start over, but Henry wouldn't let us, so we did the addendum. So we were all kind of getting confused. So if you look through that, basically it just shows the first part of the agreement we had for Stice and Wild Redberry and Carnino, and then it shows the additions, everything moving forward. And on each of those fields, you'll see what's in the base contract right now, and we also put to the right alternates that Mr. Del Sega is working to raise money for.
Okay,
in
that's the
addition.
question I have on the alternate.
Right, those will happen if he gets the money, and if he doesn't, they won't. But
Okay.
I'm betting he will.
So if they happen or if they don't happen, can you explain what they are? The maintenance equipment, you're gonna need, it has one Pioneer Chief field sweep. That's gonna be needed, isn't it?
Yes, but you don't need one for every field.
But just one would cover.
Right. Every time I'm here, I have trouble with that door.
And then,
Starting to think it's you.
I think so.
what's this 350 foot maybe portable fence? What is that about? What's the portable fence?
That's a portable fence that you can put on a field if you want to make it a smaller field for smaller age levels on one of your big fields.
Okay.
Pretty common in a lot of parks, so they get, they can bring the fences in, basically.
Okay. And the shade structure, what is that?
Shade structure was something that y'all requested for.
Just throughout the park, just extra shade and everything, whether in between games or something like that. There are plenty of trees, but it's just.
It'll be a tree or?
The contract you have in front of you is for turf stabilization and the fence around the outfield. All the alternates that are listed in there.
Well, we should look at.
No, let me finish, okay? All the alternates are the additional items that the community has identified that they're doing a fundraiser for. There's $2.5, maybe $3 million worth of those. Blaze's company does everything, so they're going to be responsible for putting it all together. So they worked with us to say, okay, on this first section, the donors specifically wanted to make sure we had turf stabilization, and you have to put the outfield fence in when it goes. So that's what you have before you tonight, and that'll finish that off. The rest of it is being fundraised.
So we can't ask them questions now? The alternates?
You can ask any questions you want, but the contract is for those
Sure,
things.
I understand.
On this last page, it's kind of a cafeteria, what do you want? And we gave them some numbers and prices for that. I know one thing, Mr. Del Sega, he would like to secure seating and bleachers. Those lights are pricey. He did ask how quickly would we need to have those in place to get material supplies in to do that. And backstops, but we have pricing for backstops with the netting and the pole system. So he has numbers he's working with.
Yeah.
And he may find some cheaper options too. And I do think his goal right now to do this is about 2.5 million. That's what he's after.
Okay. So my last question, what's a video board?
A video board is a board, it's a scoreboard, and you can run advertisements across it. Somebody had asked us to price that. I think there was one particular donor that might have bought that video board for that field, and they can run.
So that's just for one video board, but the rest of the fields they have scoreboards, won't they?
Yeah.
But the video board will be somewhere on a field if they raise the money for it?
If y'all so choose to do it.
The scoreboard, the video board can show the image of the scoreboard, so you can keep score on the video board, but in between innings, you can flip up ads, or you can show CNN or whatever, your Fox, whatever your preference is. But the video board is just another name for a scoreboard. There's there's $5,000 scoreboards, and there's $55,000
The university
scoreboards.
has a video board now.
Yeah, I mean, it's just, they were asked to quote it because, once again, all these assets can be provided by Mammoth. It doesn't mean they have to be.
Right.
But
And you also have a cheaper scoreboard.
Right.
The video board's an expensive scoreboard, let's just put it that way.
Yeah.
It's pricey.
When we were talking about this before, you brought up, you won't know until you get in there, as far as the adjustments for your estimates for the stabilization allowance. Once you dig in, you come into, are you perceiving anything moving forward after, have you found anything that indicates you guys did a topographical
They've done some
survey.
preliminary tests, need to do a geo, and that's just basically protects you from a change order coming and say, hey, we got salvage yard, not body parts, car parts.
Yeah.
It could be, who knows?
Yeah.
And I've had some fields where they've used it, they found all kind of things under there, and I have some fields that used very little of it, or if any, so, but.
You're
going
confident
in-
with this stabilization change that's gonna cover what's needed?
They have had conversations with some folks here in town, I guess, your people, and we do know that, I don't remember which field it is, there are a couple fields that are gonna have some issues. They're gonna eat up some of that stabilization.
Yeah.
What's under there?
Trash dump.
I wasn't here.
Trash dump.
My first
Yeah.
month here, you can see the dump,
A lot of Buicks and.
And you never know what's under there.
and it's about 10 feet away
Don't
too.
find any Indian things out there, you're done.
Indian Road ground, that is over. Hey, I do have one other question on the drainage. The field's got to have some kind of system, piping, drainage. Where will that water go, that you're draining off the field, or even when we put the road in? Where's all that water going?
Well, JC will go into the creek ditch.
Okay.
The other places, it's gonna go to, I haven't looked at exact drainage plan, but they're gonna drain it. Gravity works. It's not gonna go into the city system.
No, it'll go into the
It's
creek.
just
It'll
gonna
go into the natural
right.
drainage that runs through that whole park.
It's gonna go west.
Because there'll be a formal built drainage system under each field that will channel it to wherever the natural drainage system is
Right.
through the park. There's not gonna be a retention pond or anything, not anything more than we already have out there.
There's
right?
not a retention pond, but those fields kinda serve as a temporary so that water releases slower, cause they'll hold water underneath there before it just goes out in a gush.
Right.
But hey, I do wanna thank you having the trust in Mammoth, and I wanna thank, everybody for having the vision. I know Darren's worked hard on this, and Joe, and you're very, very fortunate. I've had some people step up to the plate because they want to see it done, and it's quite of an amazing thing that's come together pretty quick. I know you all been planning and talking about it, and I think we're going to get started August 1st, if you tell us that's okay.
It sounds like August 1, it's gonna start, and moving a ton of dirt is the beginning, so. The city's gonna use the dirt, sounds like that saved us a little money too. Chris has got a nice little corner of the world for all of his
Move to
dirt.
approve the addendum.
Second.
There's been a motion and a second.
And the addendum that you're
Item
having,
E, or-
that's here.
Yes, the most recent addendum.
Yes.
Yep.
All right, there's been a motion and a second to approve. All in favor, say aye.
Aye.
All opposed, same sign.
Thank you, guys.
Thank you.
Thanks. An executive session. An executive session is necessary to discuss the confidential affairs of a corporation pursuant to KSA 75-4319B4 to discuss confidential corporate affairs. Motion to recess into an executive session for 30 minutes to discuss confidential corporate affairs pursuant to KSA 75-4319 with the meeting to resume in the commission room in 30 minutes. Is there a motion to recess?
So moved. Second.
Been moved and second. All in favor, say aye.
Aye.
All opposed, same sign. recess in executive session, but we need an additional 30 minutes for an executive session to necessary to discuss the confidential affairs for corporation pursuant to KSA 75-4319B4 to discuss confidential corporate affairs. Is there a motion for an additional 30 minutes?
You gotta state.
You might just state that no decision.
Oh, yeah, no votes were cast and no decisions were made. We're just asking for an additional 30 minutes.
Second.
It's been moved and seconded. All in favor for the additional 30 minutes?
Aye.
Aye. All right, we're back from the executive session. No decisions were made, no votes were cast. Is there a motion to adjourn?
So moved.
Second.
Been moved and second for adjournment. All in favor say aye.
Aye.
Aye. All opposed, same sign. We are adjourned.